Hi, and welcome back to Unmasking the Trans Movement with John Euler. I'm your host, Brad Wilder. Today, John Euler and Dr. Ann Gillies return for part 2. They're going to take a look at some fantastic books that Dr. Ann has been writing and getting out there. They're books that, well, are going to help parents, grandparents, and children alike. Great to have you back for part 2. We covered so very much in part 1 that, well, part 2 is a necessity now, and possibly even part 3. I think you've got 5 books under your belt so far. Is that the number, Dr. Ann?
Yes, another one's partly done. So, yeah, but that might be it for the year.
Well, that's fantastic.
And back. That's exactly what we're going to segue into from the last episode. We want to encourage everybody to get your newest book, Whatever Happened to Emily. We covered that in part 1, so I recommend people review part 1, especially parents and grandparents, because you have written that book. It's a tremendous resource now for parents to be able to sit down with their child and review. It's really following a fictitious story, but based in real life situations. As far as the influences that are brought to bear that unduly influence the minds, the emotions, it used to be called brainwashing, right? When we're unduly influencing a kid in a certain direction. And that's really what's happening. And you've been speaking to that. Why don't you list your books thus far? Because you're working on another book, and we're going to cover, we're going to look at that and give parents an overview of what are our concerns about the trans movement or trans deception, which is part of the title of your upcoming book. So remind the viewers, what are the different books that you've written, and give sort of a thumbnail overview of each one.
Absolutely, John. Thank you. The first one I wrote actually was called Deep Impact, Integrating Theology and Psychology in the Treatment of Complex Trauma. And I would probably add some things to it now. That was written in 2016, but there's so much more to add now. But I think, so that was my first one, and it's just a basic primer, if you want, I think, I wrote it particularly for pastors. For people that come into the church, they end up interacting with, and they're kind of lost in, how do I deal with this person who's exhibiting all kinds of symptomatology of trauma, and to understand the symptoms and then some of the behavior. So that's that book. Then in 2017, I wrote Closing the Floodgates, Setting the Record Straight on Gender and Sexuality. And that book is highly referenced, and it's really tracking the sexualization of our culture from 1948 until the present day, including the trans movement that's happening. But it really gives us a history. Then I wrote Damaged by the Predators Among Us. It just came out in December of 2022, and it is our personal story, our family story on pedophilia, which is the reason that I do what I do, and that I have always really wanted to advocate for children and to have them retain the innocence of childhood and not be caught up in the sexualization and the sexual abuse that's happening in our world. So that was Damaged by the Predators Among Us. And then I wrote a quick book, a short book called Implosion, that is basically just talking. It's about 10 chapters talking about what's happening right now. So I've got a chapter in about black and white, how people identify as the opposite race, and furries, and it's just 10 chapters packed with current sexual issues that we're really tackling in our society. Then came Whatever Happened to Emily, which has just come out. So, and it is a children's book. I do plan, John, on doing a series on Emily so that we can kind of track her and her friends, because I think it's really important, and children like to kind of follow that. Oh, I want to find out what's going on next. You know, and I think that will be a good venue for children and their parents. Then what I'm working on right now, actually, I've got this up. I'll just share my screen. This is it might be a little blurry for you, I'm not sure, but this is the cover of my next book. It's called The Ultimate Deception, The Truth of Gender Affirming Care. And so it's a bit more clinical, but I've tried to write it, again, for parents and grandparents primarily, to understand why affirming a child's thoughts and feelings and behavior may not be in their best interest, and why medicalizing them is definitely not helping these children. So in fact, it's putting them, like you like to talk about, John, on a trajectory that actually is very, very deceptive and very physically mutilating. So those are the books. The other one that I'm writing, so Ultimate Deception is written. It's just in the final stages of editing before it goes to the publishers. And then I am writing another one called, this is also for parents and grandparents particularly, Loving Your Non-Conforming Child. And like Emily, it's not going to be a children's book, but it will, like Emily, it comes out of the requests that I hear when I do presentations from parents and grandparents, like how do we love? How do we help this child? How do we deal with this? And so I'll be talking about the parents' trauma. I'll be talking about the grief that they have to process themselves and how to keep themselves well as dealing with that child and continuing to love them, but not their behavior. So that's kind of been a mouthful, but that's kind of brought us up to date.
Well, you've been, again, very prolific in producing material to help people understand and navigate this whole confusing realm of, as you say, gender affirming care. We're hearing all these terms, but really the trans movement.
Right.
So I have ready, and I'm going to bring up various screenshots, various slides, and we're going to have you address them ultimately to help parents. There's a number of parents that are probably, and people in general, that are just sort of cluing in, even though this issue now has been around for over a decade, actually 2 decades now. So it's so ubiquitous that people have come to accept that the trans movement is real. They think that there are trans kids, there's trans people. As a matter of fact, if we say there isn't, then we're accused of hate speech, we're accused of denying minorities and groups that are marginalized. And that shows you how effective this ruse has been. And we've been around doing therapy long enough. We've been around long enough to have a little perspective. So we're here to tell people that ultimately what they've been told is true is not. And so to be able to help people have a little bit of context, understand how did this whole thing come about, so that they understand and appreciate, as you're saying, and you don't want to affirm this stuff because we're sort of coming out of a deficit in this sense. It's like we're having to argue ourselves out of a negative, those of us that are protective of kids, right? That what used to be commonly understood is everything's been turned on its head. It's been inverted. And so now the idea of affirming, the term affirm is a positive term, but it's all been twisted to where parents don't understand that if you affirm a child, you're going to fast track a child toward a certain inevitable outcome. So, Anne, as I bring some charts up now, speak to what I just said, and then we're going to get into a number of things that people need to know.
Absolutely. And one thing I was just going to say, John, you're affirming a lie, ultimately. That's the bottom line. When you tell the child, or even, just don't even tell them, but just kind of nod your head and agree with them, that they can be an opposite sex, you're affirming a lie. And there's nothing more dangerous than parents lying to their children.
Right. And for instance, sorry. Mm-hmm. Well, that happens on air. That kids can be born in the wrong body. And so that people can understand now, we're going to give a little context, that it's not just us crying wolf here, that people need to be aware of and how dangerous this is. Statistically speaking, and Michelle Cretella used the term a J curve. This is very much what a J curve is. that there's a difference between a trend versus a tidal wave, right? And what we're looking at is this, of course, comes from Tavistock. People can see the numbers of patients that were referred.
Is that Tavistock, or is this in Australia, Royal Children's?
Oh, I'm sorry. Okay, this is Australia. I've got one of Tavistock that we're going to show.
Yes, you do. Well,
okay, right. So thank you for clarifying. This is Australia, which shows people this is not just regional. So when you have a phenomenon all around the world, I'm going to scroll down and we're going to see what happened in the U.S.
Yep.
Okay, so Fenway Health is one of the larger, quote unquote, affirming medical centers. So what you see is everything is pretty much flatlined until about 2000. Well, there's a little blips starting in about 2005, but you can see about 2009. So there's essentially zero referrals to about 2009. We're going to look at some of those influences.
And both of these charts, if you see, they both go up. I think both of them go up to 300 or 350. Is the one from Australia to 350?
That's right. That one. Yeah,
no,
but it's not even
300 children. So
that's right.
Children referred. Now I have charts that are up to 2022, and the latest, which the trajectory keeps going, but the latest information was, I think, the U.S. in 2022, yeah. Between 2021 and 2022 in the U.S., so they had over 5,000 children referred. So we've gone from 0 to 300 children in 2017, basically in these two different countries, and then from 2017 to 2022, it's incredible. It's exploded even further. So now we're up to 5,000. Now think about this though. Out of a country of millions of people, this is still a very rare phenomenon. It's just that we are being inundated moment by moment, and children 6 hours a day with this, that it's become like the child next door. Every child or every family has a transgender child. No, that's not true. 5,000 in the U.S. were actually referred to clinics in 2020, between 2021 and 2022. Still, this is a minority population, but this minority population gets so much exposure in every context of media and education. So that's why it's exploding so much.
Right, and because it's so ubiquitous, it almost psychologically does a number on us, and the average person begins to think, well, it's always been this way, but it hasn't. So prior to the year 2005, there's essentially, this was unheard of, quite frankly. But Anna, I now want to bring up, we're just going to kind of at random, we're going to bring up some graphics to help show what are some of the influences that have brought this about. And you have spoken at length on different issues pertaining to these different things. So here's a graphic. This is overlaid on the referrals in Sweden. I'm going to enlarge this now. And this is talking about some of the other kinds of influences here.
Wow, this is really good. I haven't seen this chart.
Yeah, some of them you may not have. So we're going to let you talk just off the cuff what comes to mind, because we're certainly seeing now the influence. Here's sort of the predating influence of social media, as well as some of the other forms of media.
Well, and Reddit. I mean, Reddit, Tumblr, look at Tumblr. Pinterest is there too, interestingly enough. But all of those and TikTok now.
Yep.
The reality is that these platforms are inundated with it's like there's self-help. How do I transition, and all of these, it's not just suggestions, it's just saying here's what you need to do. It's more than suggestions, it's It's you have to do this, and including the talk to your parents. Tell them, do they want a live daughter or dead son? That kind of rhetoric, but the same. So you're seeing all of those contributing factors. That's a really good chart.
There was another influence in there. As a matter of fact, let me show another chart, the growth. Okay, so let me decrease the size of this just a bit. So again, this is from Fenway Health System, so you can see that is not a trend. The only time you see something like this is with target marketing.
Yep. Yeah, and it's an explosion. And this is, if you had a virus that looked like this, and I'm not even going to go into the COVID stuff, but we didn't have COVID looking like this. I mean, for goodness sakes, this is so the only word I have is diabolical.
That's right.
How media, particularly social media and education combined, have changed the brains of our children. Look at what's happening. This is total, it's an indoctrination, but this is even more, and I think we talked about this on the show before. This is what you see in cult practices, right? That you have a targeted group of individuals, in this case children, and then they're changing the way the child thinks. And when you do that, then you see what's happening. So here I'm going to give you a quote: "As a man thinketh in his heart, so is he," right? That what we begin to believe about ourselves, we become. And if we, and this is the whole issue of peer pressure as well, why peer pressure is such an important consideration, because children want to conform. They want to fit in. And so how is the best way to do that in this particular climate? Well, that's by transitioning, or it's by having some other identity. Now we're up to, I think, it's a university in the States, I think it's Boston. I could be wrong. 40% of the students, university students, are identifying as something other than heterosexual.
College students.
Yeah, college students. And it's mind-boggling, but children and students have to identify as something now. And our school, so this is a bit of a trajectory or change of topic in a sense, but in Canadian schools, and Brad, you'll know about this, coming in September, we're going to be forced. Children and teachers are being forced to use pronouns for everyone. Everyone has to have a pronoun. You have to have an identity.
I like when you bring up the criminality of this all, because you're holding back, and I'm not going to hold back on that. And I know you are. You're being very clinical, and I agree with that. But I'm not the clinical guy, and I'm not that individual. I'm a dad. I'm a broadcaster. The criminal side of this is coercion, intimidation, and extortion. All of the above are happening in our schools, and they're happening with our kids. And if you can imagine what that's like to go through as an adult, now think of what your kids are going through. Because I tell you what, this is a legal battle that needs to be fought in a court of law, and this needs to be dealt with in a severe way, that there are absolute 100% accountability for what they've done to these children. Period. Bar none. All across North America and around the world.
And you're right, Brad, because just looking at that statistic from the university, 40% of these adolescents, well, young adults, are now identifying as something other than heterosexual. That is this whole sense of being I was going to say something really
inclusive. Inclusive, part of the group, part of the trend. You know, bottom line is everybody wanted to wear bell bottoms in the 70s. Everybody started wearing bell bottoms. Then they wanted painter pants. Then they wanted corduroy pants with the slashed pockets. It's always a trend. This is a stupid fad that doesn't need to go any farther than this. Our kids are confused enough. They're manipulating our children, and they're taking them down a road of medical issues forever in their life. Forever. We're not talking about dying without it. We're talking about dying with it or because of it. And that is far more criminal than anything else I've ever seen in history. You want to talk about Hitler? You want to talk about all this other genocide that happens? Guess what? That's what we're doing here. This is a genocide of children in our humanity. Period. Bar none.
I want to say to you, Brett, bell bottoms did not create mental illness.
No, they did not.
You see with that trajectory.
Music didn't create mental illness. There's a whole bunch of things that they tried to pin on different topics and issues and things along the way, and it never worked then, and they're somehow they've manipulated this to work now. And I tell you what, I'm smart enough to know better, and my kids are smart enough to know better, and that's why I do this every single day, is because you know what? I do know better, and this is wrong, flat out, bar none.
And Brad, you know, just in case people mistake your passion and we're equally as passionate, you're verbalizing it right now. This is what we're talking about. People need to see this. This little girl, I mean, how old is this young girl?
That's what I was going to say. This girl is prepubescent. Like, she doesn't even look like she's 12 years old.
Okay, this is what we're talking about. This is gender-affirming care. These are the faces, pardon the pun. This is the outcome of gender-affirming care. This is the kind of horrific, this is the euphemism called gender-affirming care.
Yeah.
Okay. What we want to tell people is, if you don't like looking at this, then you need to understand what gender affirming care is. These are the poster children for gender affirming care. You tell us the ages of these young kids, and then for girls, it's not bad enough that they're going to chop their breasts off. Then they're going to be incentivized to take skin grafts and make fake penises.
The thing about all this,
and they will live with this for the rest of their life. That's what we're doing to kids under gender affirming care.
Let me speak to a couple things here, Brad. Could you go back to that? I want to just
sure, by all means.
Go to a couple pictures there.
Yep.
And talk a little bit about what I saw. I'm just trying to think of which. Okay, the girl's arm. Let me speak to that first, because that to make a penis. What happens to these individuals is they're taking skins, but they have to do several layers. And I'm not a medical doctor. I'm not a surgeon, so I could make a mistake here. But
these are skin grafts.
Oh, they have to put skin grafts after. But some of these children are left with lifelong numbness and paralysis. The actual muscle and their ability to move their hand. There's all kinds of stuff. If you look at this one, they have a weight in their hand. This takes rehabilitation. It is totally unnecessary. And what are they trying to do? To make a fake penis. What is this?
Listen, we're talking about connecting the nerve endings from that part of your arm into the clitoris, and at that point, they're hoping that penis, that's fake penis, has actual stimulation to help them reach orgasm. This is a ridiculous idea. This is a ridiculous thing to be doing to children. And wow, this isn't the first time I've seen these images, but I tell you what, they're shocking every single time I see them, and disturbing.
Well, it is. And there's a couple there. You will know which ones, John. Oh, the one with the doctor, it's I see it on the bottom here to the left. No, that one's a little older, but there's one child. Yes, right there. How old? This is a girl.
That's a Canadian doctor, by the way. That's a Canadian doctor.
That's right. He's out of Vancouver.
Gallagher, she I think fled country. She was in Miami. I think this guy actually has set up shop now in Florida, but this was a Canadian doctor.
But look at the age of that child.
Yeah.
What child can consent? They cannot consent. And these medical doctors, well, there's lawsuits coming. I hope they just start a tsunami of lawsuits, because this child, under 12, maybe 12, I don't know. But how can they consent to having their breasts removed when they haven't even hardly started to develop? And they're not given any idea of what that means for their future, these girls. Never will they be able to breastfeed. Never will they be able to nurture an infant through that manner, if they ever have one. And because they're probably on puberty blockers and hormones, they will never have a child, naturally anyways. But this is assuming that, like, the child looks like they're smiling. And that can be, they can feel happiness in the moment.
That's right.
The pain has to be pretty intensive there. But the reality is, children, she's not looking all that happy. She looks like, what happened to me?
Well, it certainly didn't improve her mental health, did it?
Well, no. How can this ever improve your mental health? And, the reality is, and the studies are out there that shows that medicalization of children and surgery, particularly sex reassignment surgery, or deconstruction, if we want to call it, does not improve mental health, and it doesn't take away the dysphoria. So why are we doing all this? This is simply a diabolical plan, I will say, to eradicate children, to eradicate innocence, to eradicate the future for these children as adults.
And one of the primary factors in all this, though we'll look at, again, some additional factors. The trans deception, the trans movement would never have been made possible without the DSM-5. It went from gender identity disorder to gender dysphoria, and it made everything billable. I'm going to show a graphic. I don't know if you've seen this one as well. I've put it side by side. What happens to a culture, what happens to a country when you have created a delusion, you're affirming a delusion, then you've created internal dissonance. You have an internal war going on, which then you're going to have to numb out. And here's an interesting parallel. And I challenge somebody to come up with, if a picture's worth 1,000 words, look what happened in 2013.
Wow, John, this is a really interesting look at this. So you have the DSM.
So the Diagnostic and Statistical Manual 5. Once that was published, look at what happened, because now all the services were billable. We then see the annual rates for transgender treatment. I forget which country that is from, but they all peak upwards at 2013. And then in the U.S., look at what starts to skyrocket.
Wow, this just, and something we were discussing a while ago, John, just in a private conversation, was this whole area with the LGBTQIA+, and how drug saturated that community is, and how drugs are used to entice the children into experimental sexual experiences. And then you have this. Okay, so my mind is starting to really go, wow, I think, you're really onto something very big here. And this is very concerning. So you've got the change of criteria in the DSM, which minimizes that, it takes it out as a disorder. It's no longer a disorder. So we can't treat it, gender identity disorder. We can't treat it like that anymore. And then we have the referrals just skyrocketing. And along with that, then we have this drug, fentanyl particularly, but I'm wondering about all drug deaths.
Yeah, that'll be interesting, right? Anybody can pull up the stats. My guess is we're going to see a spike. So maybe I'll have to do that, right? In the different categories of drugs. Now, it's also interesting that fentanyl, is a certain category, but you either have those drugs that are going to get somebody up or get somebody down. So a sedating effect or helping someone feel more energized. And when a kid is depressed, what's interesting is they will tend toward initially, I guess depends upon the study you look at, something to energize them. So we probably could see, it'll be interesting for us to go look at what are the rates of rise of crack cocaine or cocaine use. Right. And then what happens with the sedatives. But,
well, and I want to speak to something else here that's just going through my mind. Remember, so 2013, no longer are therapists allowed to treat the child. They have to affirm, right?
So they're self-medicating.
Yep. And conversion therapy, the whole sense where we were no longer allowed to treat children who were confused except to affirm them. This is all in the same time span. And we create this mental anguish, this confusion that Brad was talking about in our social media and school education system. We confuse them by telling them they can be all kinds of things that they can never be, which is an absolute lie, ultimately. And then don't they have to take something to try to minimize all of the mental anguish? And so why not drugs? If anything that will take away the pain. And if they've had surgery, if these children have had surgery, well, you showed some of the stuff, it's not just one surgical intervention, it's continuous for many of these children. Look at Jazz Jennings, the poster boy of, or girl, no, he's identifies as a girl now, Jazz, but he had at least 3 or 4 surgeries just to create a penis. And some of the complications, lifelong problems that we just can't. I'm sorry, it went the other way. You got that backwards. He lost his penis to create a vagina.
That's right.
I'm sorry,
No, that's okay. And you were just talking about, now think about the internal, I don't think you've seen this slide either.
No.
This one has to do with, think about where these drugs are being dispensed. And here in the U.S., red represents conservative or quote unquote Republican-held districts. We're not going to get into politics, but the blue, or the deeper the blue, or the darker the blue, the deeper the stronghold of the liberal or Democrat mindset. And look at where the placement of all these primary transgender health medical centers are.
And that's just the tip of the iceberg, Brad, or John, because those medical services, those will be the primary hospitals that you're talking about. But gender clinics are now, I think in the U.S., upwards to about 100 of them. So I would be interested in seeing, because I expect it's the same constellation, that where the nation is more conservative in their understanding of sexuality and their sense of who people really are, you're not going to see that many gender clinics. But where is particularly large cities, those are, the influencers, for this whole movement.
That's right. So here I threw a sort of curve, but it was worth looking at.
Really interesting.
Let me bring up, and again, I know we're in a way, this may feel like we're all over the map, but we're really trying to help people understand that there are so many different influences in play. And how did this come about? Where did this come from? Well, we've got another screenshot here. I'm going to increase it. So looking at, trying to provide a little bit of context here.
Yeah. So, we haven't talked about drag queens yet, have we?
No, we haven't talked about RuPaul. You just referenced about Jazz Jennings. So you can see how not just social media, but look at also, I've never seen an episode of Sex Change Hospital, but apparently that was one of the first ones. I've never seen Transform Me. Apparently the black actor who's did a sex change or is cross dressed. So I forget her name. I think she played in the Oranges or that prison. I need to get out of the box and watch more TV.
Who has time?
There was a program about female inmates, and so the actor who's a cross-dresser in Transform Me, that was pivotal in launching that acting career. So you have a lot of media. RuPaul, I forget how many seasons now RuPaul is in. I'm going to scroll down a moment because I think this one's going to show I'm going to scroll up. Okay, everybody kind of bear with me. There's the influence again of RuPaul. So RuPaul is a cross-dresser. That was 13 seasons, but I think they're up to like 19 seasons now. So you can see that there was an uptick in referrals, but then it kind of mellowed out. So we have all these influences that began to prime the pump for the introduction of billing of all these different services. So this stuff did not come out of the blue. There is another, I'm going to scroll again. Everybody's going to have to forgive me here for kind of this archaic way of doing it. So here again, there's RuPaul, and you can see the dramatic uptick.
Wow, look at that. So 6 children in 2009 in that's Australia, I think.
Correct. There we go.
And then look at and RuPaul comes on the scene because this is all media influence, right?
That's right. It primed the pump for all this.
Change the minds of the children. We're changing their brains. They're tracking on new pathways. One thing we haven't talked about here is the effect of porn. I'd like to see.
Well, okay. How did you know? Bear with the archaic method of doing this, but we're going to. There is Andrea Long Shu. I'd never heard of her until we had Alex Aaron on, and this is a guy, and look what he says.
So he's male.
This is a male who's been very influencing in terms of academics. So what does he say about sissy porn? That's porn that is driven at young men that causes them to want to cross-dress. So down at the bottom, sissy porn, it did make me trans.
Wow.
So Andrea Long Shu. This is a guy, a biological male, who has written about the justification of gender-affirming care as well as downplaying the influence of pornography.
So I want to look at this from someone, and many of your viewers, John, might be new to this, and the reality is you look at this individual and you think, of course, blouse is open. I mean, how sexualized is that? They don't want to be sexualized, but they want to be sexualized. So this was a male, looks like a woman now, and for the general public, the populace, it's going to be more and more difficult for them to determine what the individual's natal sex actually was. And the skewing of the lines, the skewing of all of what was normative with now this, like we're just hitting the tip of the iceberg of what we're really, really trying to talk about here. It's the mind control. It's the ability to change people's mind about what is real. Because you look at that individual and think, she's a real woman. But she's not. She wasn't born female. And there is no, we have to come back to the actual biology, because this is what is eradicating women.
That's exactly right, Anne.
Mm-hmm. Eradicating womanhood, motherhood. It's just so diabolical.
Well, there's just so much to cover in all of this. We are actually ran out of time today, guys. I'm sorry. We could probably go for another hour. There's just so much and so confusing for a lot of people.
It's jam-packed.
We do really appreciate you bringing it all to light today. We appreciate that you continue this fight and that you keep this momentum going so that other individuals who, this is a roller coaster. Grandma always liked the roller coaster. It was lots of fun. Well, this life ride has become a challenge. It's not as much free fun anymore. It's now we're meeting walls and we're having to do different things to try to combat some of this. Listen, keep your head up. Go ahead, Ann.
This roller coaster's gone off the rails, Brad.
Yeah, I agree, it has. But you know what? It's okay whether we're hitting it with our own families or whether we've gone off the rails. There is a way back, and there is the proper help to find. We provide it here. You provide it on your local levels. Listen, there is help. There is help, and you are going to be knowing that you're not alone any longer. We all are taking notice, and people are standing up all over North America and around the world to this ideology. It's not going to end with us, but it sure isn't going to stop either until we do something about it. So keep the momentum, keep the courage, and keep speaking freely, because freedom of speech is what's going to drive our message forward. I'm Brad Wilder. Thank you very much to John and Dr. Ann for being here. Till next time, please find us on Rumble, BitChute, as well as YouTube. I'm Brad Wilder. Remember, it's not our kids' fight, it's our fight. We'll see you next time.